Welcome to our deep dive today. You shared a case study from the Journal of the American Animal Hospital Association about incredibly rare neurological condition in dogs, an ependymal cyst.
Yeah, it's certainly not something you see every day.
Right.
This particular case involved a 6-year-old American Staffordshire Terrier, presented with some pretty concerning symptoms, incoordination, collapsing episodes, even a strange eye movement called nystagmus.
Interesting. And what makes this case even more intriguing is that the vets initially observed what's called paradoxical vestibular syndrome,
Right.
meaning the dog's symptoms didn't quite line up with a typical inner ear problem.
Precisely. It was a bit of a puzzle at first. To get a clearer picture, they performed a brain CT scan. The results were pretty striking. They revealed a hypoattenuating lesion with peripheral contrast enhancement in the fourth ventricle, essentially a shadowy area that lit up with the contrast dye, indicating a cyst.
Okay, and this cyst was causing a complication called secondary hydrocephalus, a buildup of cerebrospinal fluid that puts pressure on the brain.
Exactly. Think of it like a blockage in a pipe. The fluid can't drain properly, leading to that pressure buildup.
I see. So initially, the dog was treated with prednisone,
Yeah.
a corticosteroid to reduce inflammation.
Yeah.
And while there was some improvement, the symptoms unfortunately recurred.
Which led the veterinary team to consider a more definitive approach: surgical removal of the cyst. They performed what's called a suboccipital craniectomy to access the back of the skull and reach the cyst.
Got it. And during surgery, they used mannitol, right, to help reduce brain swelling and prevent further complications.
That's right. Mannitol is a powerful osmotic diuretic, helps draw fluid out of the brain tissue, creates more space to work, and minimizes the risk of injury.
Yeah.
It's a critical part of many neurosurgical procedures.
Now, when they finally reached the cyst, they found it to be a grayish, fluid-filled structure.
Mm-hmm.
And upon examining the fluid, it was described as dense, brown, and containing cholesterol crystals. Not your typical cerebrospinal fluid.
Definitely unusual. The next step was to send the cyst off for histopathological examination to confirm the diagnosis.
And the results did indeed confirm their suspicions. The cyst was lined with ependymal cells, those specialized cells typically found in the ventricles of the brain.
And these cells had a characteristic feature: cilia. Tiny, hair-like projections that help move cerebrospinal fluid, a classic hallmark of an ependymal cyst.
But here's where things took a bit of a turn. Immediately after surgery, the dog's neurological condition actually worsened.
It's not uncommon to see some temporary deterioration after brain surgery. In this case, the dog developed severe vestibulocerebellar ataxia, meaning difficulty with balance and coordination. He was also temporarily unable to walk, and his nystagmus became more pronounced.
So what did the veterinary team do to manage these post-surgical challenges?
They quickly implemented a comprehensive care plan. This included administering a combination of medications like cefazoline to prevent infection, meropitant for nausea, beta-histine to help with dizziness, and dexamethasone, another corticosteroid, to further reduce inflammation.
A multifaceted approach to address the various symptoms and support the dog's recovery.
And thankfully, it proved to be effective. Within 24 hours of surgery, the dog was able to walk with some assistance, albeit with an exaggerated gait.
Wow.
And just 4 days later, he was discharged from the hospital, still with some nystagmus, but able to walk with minimal help.
It's amazing how resilient dogs can be, even after such a major procedure.
Absolutely. But of course, his journey didn't end there.
Right.
He continued with medications at home, including another antibiotic, cephalexin, along with the beta-histine and prednisone, with the dosages gradually tapered down over time. Regular checkups were also scheduled to monitor his progress.
And as the weeks went by, his ataxia gradually subsided. By the 6-week mark, only a slight cerebellar ataxia remained, a remarkable recovery considering the initial setback.
It really speaks to the skill of the surgical team and the dog's own incredible ability to heal.
And what's even more remarkable is that 4.5 years after surgery, this dog is still doing fantastic.
He's leading a happy, active life with only occasional balance issues when making sharp turns. A truly inspiring outcome given the rarity and complexity of his condition.
So this dog's story provides a glimmer of hope for other dogs facing a similar diagnosis.
It certainly does. However, it's important to remember that each case is unique and outcomes can vary. This brings us to a crucial point. Champ's case, while successful, also highlights how much we still don't know about ependymal cysts in dogs.
Absolutely. There are so many unanswered questions about the cause, the progression, the best treatment options.
Well, surgical resection, as in Champ's case, is often considered the gold standard. it might not always be feasible or successful.
So where do we go from here? What other treatment approaches have been explored?
Well, there are a couple of alternatives to complete resection that have shown some promise. One is fenestration, which involves creating a small opening in the cyst to drain the fluid.
Okay.
Another is shunting, where a device is implanted to redirect the fluid to another part of the body.
Sounds less invasive than a craniectomy. What are the downsides?
Well, they might not be as effective in the long term, and they come with their own set of potential complications. Fenestration, for instance, carries the risk of the opening closing up, and shunts can malfunction or become infected.
It seems like a delicate balancing act. What factors influence the decision-making process?
It's a case-by-case situation. The size and location of the cyst play a role, as do the severity of the symptoms and the overall health of the dog. And of course, the expertise and experience of the veterinary team are critical.
Speaking of expertise, Champ's case really highlights the importance of choosing a veterinary hospital with a strong neurology department.
Absolutely. These are complex cases that require specialized knowledge and skills. And when it comes to brain surgery, you want the best of the best.
Now, beyond surgical advancements, what about medications? What role do they play in managing ependymal cysts?
Medications can be helpful in controlling symptoms, but they don't address the underlying problem. Drugs that reduce fluid buildup, decrease inflammation, and improve neurological function are often used.
So, a combination of approaches is often needed. It sounds like there's still a lot we don't understand about ependymal cysts.
Indeed. More research is needed to unravel the mysteries surrounding these rare occurrences. And Champ's case, while just one story, adds valuable data to our limited body of knowledge.
This brings me to something you mentioned earlier. The uniqueness of this case. What makes it stand out from the few others that have been reported?
Well, this is the first documented instance of a completely resected intraventricular ependymal cyst in a dog with long-term follow-up. Having 4.5 years of data on his progress after surgery is invaluable. It provides insights into the potential for long-term recovery and helps guide future treatment decisions.
It's like a beacon of hope in the often uncharted territory of rare neurological conditions.
Exactly. It shows that even in the face of challenging diagnoses, positive outcomes are possible, and it fuels our drive to push the boundaries of veterinary neurology.
Speaking of pushing boundaries, what advancements are on the horizon for diagnosing and treating cases like Champ's?
That's the crux of the matter, isn't it? One area that holds immense promise is the development of advanced imaging techniques.
Can you elaborate on that? What kind of advancements are we talking about?
Think beyond the standard CT and MRI scans. Researchers are working on techniques that can provide even more detailed views of the brain, allowing for earlier detection and more precise surgical planning.
So being able to visualize these cysts with greater clarity and understand their exact location and relationship to surrounding structures.
Precisely. And this could lead to less invasive surgical procedures, minimizing the risks associated with traditional craniectomies.
That would be a game changer for so many dogs.
Absolutely. Another exciting area of research is focused on understanding the genetic and developmental factors that contribute to the formation of ependymal cysts.
So trying to unlock the secrets of why these cysts develop in the first place.
Exactly. If we can pinpoint the underlying causes, it could open doors to potential preventative measures or even gene therapies.
Now, those sound like breakthroughs that could revolutionize how we approach these cases.
They certainly have that potential, but while those advancements might be a few years down the road, there are other promising areas of research that could have a more immediate impact.
Like what, for example? You mentioned minimally invasive techniques earlier.
Yes. There's growing interest in using techniques like endoscopic surgery, where tiny instruments and a camera are inserted through a small hole in the skull.
It's incredible to think that brain surgery could become so minimally invasive.
It is. And while these techniques are still in their early stages in veterinary medicine, they hold great promise for reducing recovery times and minimizing the risk of complications.
It's inspiring to see how much dedication and ingenuity is being poured into tackling this rare and complex condition. What stood out to you about the details of Champ's surgery and recovery?
What's fascinating is the use of mannitol during surgery. It plays such a crucial role in neurosurgery.
I'll admit I hadn't fully appreciated its significance before.
It's essentially giving the brain a bit of breathing room. It reduces intracranial pressure, preventing further damage, and improving surgical outcomes.
It's like a safety net for the brain during these delicate procedures.
Precisely. Another thing that struck me was that Champ's neurological symptoms actually worsened immediately after surgery. It highlights the complexity of the brain.
Even with the most skilled surgical team, There's always a risk of temporary setbacks.
But the veterinary team was prepared and had a plan in place to manage those post-surgical challenges. Their expertise and supportive care really made a difference.
And let's not forget the resilience and determination shown by both Champ and his owners. That unwavering love and support undoubtedly played a role in his remarkable recovery.
It's a reminder that veterinary medicine is not just about treating animals, but also about supporting the people who love them.
Beautifully said. Now, before we wrap up, I want to touch on the histopathology findings. Can we dive into those a bit deeper?
Absolutely. The report described the cyst as being lined with simple cubic to cylindrical epithelium with apical cilia.
Those cilia, the tiny hair-like projections, are a key characteristic of ependymal cells, right?
They are, and they play a crucial role in moving cerebrospinal fluid.
So these findings, along with the imaging and clinical presentation, painted a clear picture of an ependymal cyst.
Precisely. And that confirmation guided the veterinary team in their treatment decisions.
Now, shifting gears slightly, let's circle back to the discussion of surgical options. You mentioned that surgical resection is often considered the gold standard.
It is, but it's not always the only option. We discussed fenestration and shunting earlier, and those might be preferable in certain cases.
So the decision to pursue surgery hinges on a number of factors.
Exactly. The size and location of the cyst, the severity of the symptoms, the overall health of the dog, and the expertise of the veterinary team all play a role.
And of course, open communication between the vet and the owner is crucial.
Absolutely. It's a collaborative process with the goal of finding the best possible solution for each individual dog.
And that brings us to the long-term follow-up. We know that Champ is doing incredibly well, 4.5 years post-surgery.
It's truly remarkable, but it's important to remember that every case is different and outcomes can vary.
Still, Champ's story offers hope and encouragement to other owners who might be facing this diagnosis.
It does. It reminds us that even with rare and complex conditions, positive outcomes are possible.
And that's what keeps veterinary medicine so inspiring and rewarding. Speaking of complexities, what about the ethical considerations surrounding the treatment of ependymal cysts?
That's a great question and one that warrants careful consideration. It boils down to the balance between providing the best possible care for our animal companions and recognizing the limits of what we can realistically do.
We have to weigh the potential benefits of intervention against the potential risks and burdens.
Absolutely. Recovery time, the potential for complications, the financial aspects, the emotional toll on both the dog and their family. It's a lot to consider.
Yeah, it truly is. So how do vets and owners navigate these difficult decisions?
Well, open and honest communication is paramount. It's about having those tough conversations early on so that owners can make informed choices that align with their values and their dog's best interests.
Right.
The veterinarian's role is to provide clear explanations of the condition, the potential benefits and risks of each treatment option, what to expect during recovery.
I see.
And sometimes the most ethical path might involve foregoing aggressive treatment and focusing on providing palliative care to ensure the dog's comfort and quality of life.
That's a difficult but essential conversation to have. It acknowledges that while we strive to provide the best possible care, sometimes our focus shifts to prioritizing the dog's well-being, minimizing suffering.
Right.
Shifting gears a bit, I'm curious about the rarity of ependymal cysts in dogs. What makes Champ's case so valuable to the veterinary community?
Well, with only a handful of cases documented in veterinary literature, each new case adds to our limited understanding of this condition. Champ's case, in particular, offers valuable long-term follow-up data, providing insights into the potential for recovery and informing future treatment approaches.
It's like a beacon of hope in a sea of unknowns.
Precisely. It demonstrates that even with these rare and challenging conditions, positive outcomes are within reach.
As we wrap up our deep dive into this extraordinary case, what key takeaways should our listeners keep in mind?
Firstly, ependymal cysts, while uncommon, are a condition that veterinary professionals need to be aware of. Early recognition and diagnosis are crucial for improving outcomes.
So if an owner notices any unusual neurological symptoms in their dog, it's essential to seek veterinary attention promptly.
Absolutely. Secondly, Champ's story demonstrates the potential for successful surgical treatment of ependymal cysts, even in complex situations.
It's reassuring to know that surgical intervention can be a viable option.
It is. And finally, this case underscores the critical need for continued research in this area. We need to delve deeper into the causes, progression, and optimal treatment strategies for ependymal cysts. Provide the best possible care for our patients.
It's inspiring to witness the dedication and expertise of veterinary professionals like yourself who are pushing the boundaries of knowledge and advocating for the well-being of animals.
It's a privilege to be a part of this field, the pursuit of knowledge, the commitment to our patients, the unwavering belief that even in the face of rare and complex challenges, hope prevails. That's what drives us in veterinary medicine. From Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.